A very good evening to one and all. Welcome to yet another program of Pratignja. So today we are going to have the introduction of a new program by Pratignja called Subaalyam, which is a course on the Kaumarabhritya aspect of Ayurveda. So this is the program that we are about to embark on, and we'll be starting the program on the 21st of February. And the timing of the program will be 7 to 8. We have wonderful teachers, eminent scholars, eminent teachers for this program for you, and we'll be hearing from each and every one of them. So as you know, we have been in this, we have been, this is actually the 8th class that we are conducting. The first class was on cosmetology, the second was on Keraliya Panchakarma, and the third was on Agni Karma procedure. There was a program called on Uttaravasti, and then we had a program on another cosmetology, on topics like cosmetology, etc. And sorry, cosmetology, trichology, and aromatherapy, etc. The next program was even now it is going on, is called Ashana, which is a program on the diagnostic methods both in Ayurveda as well as in modern. We have eminent scholars for every program that we are having, and that is the thing that we emphasis upon, that we need to have good teachers for the program. This is a Vastikarma program that again is currently we have started, and it is going on right now. And these are the feedbacks from our participants on the program that we have started each. And I thank each and every one of you who have helped us spread the word of Pratiknya to all your friends and colleagues. Thank you for your support and guidance also, because there are a lot of suggestions coming from the participants about the same. And this is another program that is we are going to start this program the 28th, the next Sunday. We'll be having the introduction of this program. It will be taken by myself and Dr. Alex. So the details will be put forward later on. Again, so let us come to today's program, and today's program is the introductory session on Subaalyam, a program which concentrates on Kaumarabhriti aspect of Ayurveda. So we'll be hearing from each teacher on what are they going to take, and how the students, what the students can learn from them. So we will go by each, we'll go to each sir, and they'll be giving you the introduction of their topics. The program itself is going to start on the 1st of March. I'm very sorry. Today was, in fact, the introduction 21st was today. So the program is going to start on the 1st of March, and we'll be having it. And the end program will be on the 31st of March. So we'll be having 30 days of program. So the timing is again, I'm very sorry. I just read it from the introductory. This one, the timing is 8 p.m. to 10 p.m. so that it is easier for all the students, easier for all the practitioners to come home and then learn. Okay, so we will be hearing from each and every teacher. So first, I would like to introduce Dr. Dilip KS, and I will be introducing him before I hand over the mic to Dr. Dilip. So Dr. Dilip KS, Associate Professor, Department of Kaumarabhritiya, Ashtanga Ayurveda Vidyapeetham, Pattambi. 6 years of experience in Kaumarabhritiya department, presented papers in various national and international seminars, active member in uh, Changadi, a non-profit organization which works for the welfare of children, works for the care of differentially abled children in association with ALDA, Association of Learning Disabilities in India, and in the internal auditor of NABH. So let me hand it over to Dr. Dilip, who will be giving you a basic idea about what he is going to, give you. What are the topics he will be taking for you in this class if you are joining. So, Dr. Dilip, hello.
Hello. Hello,
Hello,
Dr.
sir.
Shyam.
Yes, sir. Over to you, sir.
Yes.
Thank you. Thank you.
Okay. A very good evening to one and all. First of all, I would like to take this opportunity to thank the team Pratignja, Dr. Shyam and Dr. Rahul for giving me an opportunity to be part of this online certification program. Kaumaripatya is one of the main branch of Ashtanga Ayurveda, as it deals with the prevention and cure of childhood diseases. Uh, so the main aim of this branch is better development of children who are tomorrow's future, the wealth of our nation. So as we all know that the whole world is looking at Ayurveda for the management of various types of diseases where the modern medical science doesn't have any specific protocols. So, but Ayurveda being promoted or widely popular for mainly for Panchakarma therapies and massage therapies and all. But very unfortunate to see that the branch Kaumaripritya is not being practiced widely as a super specialty. So maybe because of our, either our syllabus, which does not give much importance to the practical oriented topics, or lack of confidence among the doctors. So there are many areas in Kaumaripritya uh, yet to be explored. So there comes the importance of the team Pratignja, because they are trying to fill this gap by conducting some regular classes, as Dr. Shyam were explaining right now. So classes in a practical way. So I think this definitely this is going to help you all. So Ayurveda can give promising results in many of the developmental disorders and many pediatric disease conditions where the modern science fails to act. This course, as Dr. Shyam explained, uh, includes he has included many of the pediatric diseases which are commonly seen in day-to-day clinical practice. So I strongly believe that this online certification course program will enrich your knowledge and helps in your clinical practice. So I'll be dealing with 5 topics in this program. So my first topic will be, I'll be dealing with learning disability and its management. So learning disability. So in this session, I will be discussing about the different types of learning disability and different types of presentations and its Ayurvedic perspective of learning disability and its management. Because nowadays, even I have noticed in my OPD, many times the parent comes to our OPD self-diagnosing the case as a learning disability. So they directly say that the child has problems in learning, and they self-diagnose the case as learning disability. So we should have a thorough criteria, thorough understanding, and we should have a standardized criteria to diagnose the case as learning disability. So I'll be discussing about the assessment of learning disability and the standard guidelines, so standard criteria for the diagnosis of learning disability and its Ayurvedic perspective and management. So that will be about my first topic. In the second topic, I will be discussing about the pertussis. So pertussis normally will have different symptoms at different stages of the disease. It is very important to diagnose the case at the early stages, because the early stage when we manage the case, we will be getting more results. So I will be discussing about the symptoms at different stages along with its radiological findings. Because in X-ray, we can easily make out the differences in the at the different stages. It can easily make out the differences in X-rays. So I'll be discussing about its symptoms at different stages, its management, Ayurvedic management of pertussis, and even our management will be different at different stages of the disease. So I'll be discussing all about that. So that's about the second topic. And the third topic I'll be discussing about procedure-based therapies in pediatric clinical practice. So in this class, I'll be discussing about some of the commonly practiced therapies. The Bahiparimarjana procedures particularly. I'll be giving more importance to the Kerala specialized procedures like Talapodichil, Talam, Shidopiju, etc. treatments. So how to select this treatment, and in what all conditions we can prescribe these treatments, and what are the some of the important medications used for this treatment. So all these details will be covered in that class, and that's about procedure class. And the next topic will be uh, important formulations used in pediatric clinical practice. So in this session, I'll be discussing about the important Ayurvedic formulations, which are widely practiced in Kerala. As we know that there are in number of formulations have been explained in our classics. So we many times we find it very difficult to select a yoga in a particular condition, because some formulations will have the same properties. So we will be in a dilemma which yoga to be selected. So I'll be discussing about some of the properties of commonly practiced formulations, its clinical indications. Mainly the guna-based analysis will be done, and not all the yogas, because it is not possible to discuss all the yogas, but few of the most important yogas which are widely practiced in Kerala will be discussed in this session. And last topic, I'll be discussing about the nutritional deficiency disorders and its management. Uh, Even in this nutritional deficiency disorders, the commonly seen nutritional deficiency diseases, the commonly seen in our clinical practice, day-to-day clinical practice. So such type of deficiency disorders will be discussed in that session, along with its Ayurvedic management. So in that, I'll be discussing about some of the few of diet preparations, because in modern, we know that usually different types of supplements are being prescribed in nutritional deficiency disorders and all. So we should have some our own supplements. So in the form of ahara. So what all aharas can be prescribed in the management of nutritional deficiency disorders will be discussed. A few of the important diet preparations will be discussed in that class. So this is all about my topics and its discussions. Uh, Hope that this topics, not only these topics and the other topics discussed will be discussed by the other eminent faculties here, will definitely going to help you in developing your clinical expertise. So, Dr. Shyam, hope that I have conveyed my topics and its relevance to the participants.
Yes, Dr. Dilip, thank you. Thank you for introducing your topic. Thank you for that. So
Thank you,
thank
Dr.
you. Yeah,
Shyam.
yeah. So before we go to the next teachers, I just want to point out that Dr. Rahul will be posting a link in the chat, which you can click and you can join a WhatsApp group where we'll be posting all the details about this class, like the brochure, all the the topics. We'll give you all the curriculum, everything will be posted in the group. So if you can click on the link and join that group, you'll be informed about this one. And of course, as Dilip sir said, it is very difficult. I am absolutely terrified of treating children, to be very frank, because they are very delicate in my mind. And hats off to all the Kaumarabharti practitioners for that. So we'll go to the next teacher now. We have Dr. Krishna Kumar. Dr. Krishna Kumar K currently works as a professor and HOD of Kaumarabhartya Evam Balaroga at Ahilya Ayurveda Medical College, Palakkad. Completed his BAMS from Jayendra Asudaya Ayurveda Medical College and MD in Kaya Chikitsa from Hubli Ayurveda Mahavidyalaya. PhD scholar at Mendosur Ayurveda Institute and Research, Madhya Pradesh. Experienced as a main coordinator and scientific committee head in Jnana Tabasya, an international seminar organized health surveys for school-going children in nearest vicinity of Palakkad district, organized and participated in medical camps and flood relief camps of college, worked as assistant professor and associate professor at Amrita School of Ayurveda, Kollam, worked as chairman of university exams of Kaumarabhartya in 2017, co-coordinator of Ahilya Research Committee and Research Monitoring Cell, working as a team member of NABH and NAAC Monitoring Cell in Ayurvedic colleges. So a very good friend of mine also, Dr. Krishna Kumar. Over to you, sir. Thank you.
Hi, good evening. Good evening, all. And once again, thank you, Dr. Sham and Dr. Rahul, for the wonderful opportunity which I'm getting here. And once again, uh, I'm I think I'm blessed to have such number of participants. I also before also we have joined together for the sessions. Uh, yeah, let me come to my topic actually. Dr. Dilip rightly said about the importance of Kaumarabhritya, and Dr. Sham has already stated that it is a bit difficult for treating children. So being a Kajikitsa man who came to Kaumarabhritya, since 5 years I'm practicing Kaumarabhritya here. So it was a Himalayan task for me that from geriatric to pediatric aspect. So it's a task for me. But still, once again, when I came there in Kaumarabhritya, I found that actually children are not smaller adult, but thing is there are a lot in common with the children where the adults are getting the treatment aspects and the other aspects. So, but when I went to the practice aspect at the time, I found that some of the things are very relevant, which I have to discuss with the with the community from the Kajikitsa angle and from the Kaumarabhritya point also. That is very relevant. That when I'm treating an old man, it is very difficult, and the medicines are not working. That is what uh, I I have personally found out. But when I'm giving a medicine to a child, uh, the child is getting curable aspect faster. So that is what I found from my personal angle. So when Dr. Sham asked me whether you are comfortable with this topic, uh, I found that since from the past 5 years, what I was doing in Ahalya, the same thing only Dr. Sham has posted me, and myself and Dr. Dilip, who has presented there just before, we were witnessing those cases. Actually, I was given opportunity to give you a lecture on pediatric speech problems and floppy baby syndrome and common renal issues, arthritis, juvenile arthritis, and Down syndrome. These 5 topics actually it means something that which is very relevant for the current era and for the practitioners. When a parent comes to you in front of you and tell you that my child is having a speech problem and the child is not talking, so initially when it came to me at the time, I thought that it will be somewhat difficult task for me to keep, because I didn't thought of any of those things. So I suddenly called some of my friends, and then I inquired about such aspects, and then lightly I managed in the initial phase, like Amapachana aspects and all. I have managed them. Once again, I send them off. Later on, when experience comes, then only we will study. That is the important thing. So later on, I took the topic to the students, and then afterwards, when when the patient came back, at the time I was ready with the prescription and all. Some of my eminent friends, they have helped me out also. So it was in the first year when I started practicing Kaumarabhritya. So the thing is, understanding the speech difficulty, speech problems are very important for a physician. That whether when the problem comes before going to the allopaths, if it is coming to you, then we have to understand that how to diagnose it first, and then scope of management in Ayurvedic sector, how we will manage. And another one aspect is how we will formulate our prescriptions and how we will lead our treatment. Those four aspects we have to be very thorough. I will be dealing in detail about such aspects where there is no way further, we have to dig the way. Then what to do? That will be the session. The common pediatric speech problems, early diagnosis and management scope, a scope for an Ayurvedic physician. That aspect I'll be trying to do the justice. And next one is one of the wonderful topic where it is termed as Asadya Roga, that is floppy baby syndrome. And another one disease also is there, spinal muscular atrophy. Most of our Ayurvedic pediatricians we are treating. So when such a case comes to you, you know that it is Asadya Roga. How you will be treating? If you are telling it is a Pratignja Roga also, is that true? Or what are all its stages, and how to diagnose? What will be your physical examination tools and other mode of examinations, and how you have to formulate a therapy protocol, and what will be the treatment aspect, and what will be the most probable outcome that you are going to get in the nearest future. That is what I am dealing it in floppy baby syndrome and spinal muscular atrophy, contemporary management and an Ayurvedic physician's angle. That aspect we will be dealing in the second session. And in the third aspects, it's a common one, but the thing is, if a parent complains that her child is having a difficulty in urination, or the child is having a pedal edema or facial edema, and directly in the morning hours when you come to your clinic, they are there with a renal issue or urinary tract infection aspects, then what should be your mode of diagnosis as angle, and which are all the common pathogen which can cause the renal issues, and what are all the other problems which can occur to the children. So those things should be you have to understand. In that angle, I'll be putting some of the lights which may be useful for you. And once you are diagnosed also, another one challenge is there. The children are not easily you can't convince them to take some medications and all. So there, how you have to convince, and your examination techniques, and how you have, what are all the things you have to keep it in mind when you are approaching a child with the renal issues. Those things I'll be dealing with, and the common prescriptions which are used by our eminent physicians and the fellow members of Kumar Britya here with me. So those prescriptions also we'll be discussing a light. Such angle we will be having a discussion on third topic. And fourth topic is it's a common one, like juvenile arthritis, JIA. You know that there is a single joint affecting arthritis are there, and multiple joint affecting arthritis are there, and systemic arthritis, psoriatic arthritis, so many other types of arthritis are there. Some are due to some infectious aspects, some are due to some autoimmune aspects. So we will be dealing those things in detail, and how to diagnose it, and where to stop, and what are all the things what the modern doctors they are doing, and maximum of what extent a modern doctor can treat, and they can keep it there, how we can intervene, and how we can make our yukti, and we can make our prescription, and in what way you have to think, especially when you are treating with a child. There I'll be dealing a bit about avarana aspect, and amavada vadarekta aspect also, and their dosage aspect. Entire sessions we'll be doing it, especially arthritis. Most of the arthritis are common, so we will be doing it in a better phase in the fourth aspect. And in the fifth session, I was given Down syndrome. As you all know that it is it is an asadhya vyadi. But thing is, how to prevent it, that is very very important aspect. And if at all one parent they have got one child with Down syndrome, otherwise one time they have they have conceived a child, but about it, and then next time they want to make a child, at the time what should be your stand, and where you will stand, and then advise the parent how to you know be better aspect, and how you will manage the business, and how you will educate the parent. That is also another one part which I am dealing. uh, I guess those things will be the important part. And what the team Pratijna is doing, it's a great thing. you know uh, it's a useful thing, what I guess. And I'm also very eager to hear about what the opinion of the others, and we'll be making it as a discussive point also. So that is what I want to tell you people about this topic. And see you soon. Thank you,
Yeah.
Dr. Shah.
Thank you, Dr. Krishna Kumar. Actually, what you said is right, sir. Right now, COVID taught us something. We are, all the Ayurvedic fraternity can learn from home itself, without sacrificing their practice and other things. So, thanks to you for introducing the topic. Thank you, sir. So, we'll be moving forward to the next, teacher. Of course, before that, there are links posted by Dr. Rahul in the chat, which you can use to join a WhatsApp group where we'll be posting all the details. Even this video, if you have just come into this introductory session, we will be posting the video of this introductory session in that group, so that you can go back and listen to that and see if this program is for you. And as Dr. Krishna Kumar said, the relief of the parents, when the child is given some relief. Oh my goodness, can't believe that. So let's go to the next teacher. We have Dr. Dinesh KS with us. Dr. Dinesh KS, the professor and HOD of Kaumarabhartya Vaidyaratnam PS Warriors Ayurveda College, Kottakkal. Did his BAMS from Calicut University with first rank, MD from Gujarat Ayurveda University, and pursuing PhD from SCSVMV University. Having specialized expertise in individualized protocol making and management of autism, Ayurvedic management, and specially designed procedure-based therapy in children with developmental disorders, infertility management through Ayurveda therapies and lifestyle modification techniques, individualized protocol making, and Ayurvedic management in preconceptional care, especially to high-risk couple. Working in Ayurveda Academy in different Ayurveda colleges since 2006. Now as professor in the Department of Kaumarabharti at Vaidyanatnam PS Warriors Ayurveda College, Kottakkal, under the Kerala University of Health Sciences. Founder of CIMCD, Center for Integrated Management of Children with Differential Abilities, Kottakkal. Founder of Ayukam, Ayurveda Center for Autism and Learning Disability Management, Kottakkal. Lifelong member of Indian Science Congress, member of INDRA, International Network for Development of Research in Ayurveda by European Academy of Ayurveda, Germany, member World Academy of Science, Engineering and Technology, Scientific Committees and Editorial Review Boards, member of Board of Studies of Ayurveda, University of Calicut, 2016, the chairman, Board of Studies, BSc Nursing, Ayurveda combined. And there are lots and lots of things that I have to tell about Dr. Dinesh sir. And I would, I would request him to introduce this topic for Subaalyam, the program that we are going to conduct. Over to you, Dinesh sir. Hello.
Hello. Am I
Over to you,
audible?
sir.
Yes.
Yes, sir. Yes, sir. Thank you.
A very good evening, one and all. And first of all, let me thank the powerful organizers of Pamba program. Actually, Dr. Shyamo and Dr. Rahul and team. Actually, they are in a fast pace. They identified the real trust area for Ayurveda, and they are trying to propagate the real sense of Ayurveda through different programs. I appreciate the team. And once again, congratulate you for taking this pediatrics as a specialty in such propagation. See, this is a classical example. think that there are two roads. Number one is a village road. Second two is National Highway 47. And so many vehicles are going through National Highway, and very few vehicles are going through the village road. Ayurveda, its epistemology, its theoretical background and practice is just like a tanker lorry, is just like a container lorry. But right now it is going through a village road. How its movement will be, you can imagine. But there are several trucks and several small vehicles which are running fast through the national highway. Those are modern science and other current science and technologies. One thing is sure, if we want to make a pace with the current society, with this load of this tanker lorry, or otherwise this container lorry, we should come out of this village road to this national highway. And Pampa is doing one such work, that you are introducing a national highway by a continuous effort, and you are directing this container lorry into this national highway. And by that, you are creating the history exactly. There are several other organizations are also, they are doing such hectic jobs. In this, even though this is a corona crisis time, they are doing such wonderful things, and I'm very happy to join with you. That is the reason, this is the real reason why, because I am joining all of you. Then now coming into this topic, actually, you know, Indian Ayurveda doctors are doing wonders. The only people who don't know this fact, that these people are doing wonders, the only people who don't know this wonder or this phenomena is Ayurveda people of India. Those Ayurveda people or the BAMS people who have passed their Ayurveda from India don't know that they are doing wonders. But all the global population, scientific population, especially the experienced technical people, who are very well aware that these people, these Ayurveda people, are really making wonders. But unfortunately, one lacuna in our side, that whatever we are doing in our practice, in our thought process, are not getting disseminated across the technical society. They are not spreading into the scientific community, either by conferences or by writing or by scientific article writing. So the main problem from Ayurveda community is that they are very poor in documentation, they are very poor in publication, including myself. That is what I am telling. So the first or the initial phase of our dissemination of the knowledge or dissemination, recording of our practice and getting into the scientific community globally is that capacity building. We should build our own capacity in a right way. And hope all other the participants of this program, hope all of you will get enough capacity after going through this program conducted by Pamba as a series, because the structure and the mode of conducting this prestigious event is highly scientific. They are touching almost all the topics which are connected to day-to-day practices of a common physician, not the pediatrician, common physician who is encountering a pediatric case. And they are touching almost all the issues. Not only that, while preparing the material for the circulation regarding this conference, this learning series, Rahul and team are very keen to pick up the ideas from the experts. That's exactly what we need, is the practical point of view and then the theoretical interpretation in day-to-day common practice. So that is, they have really pinned the problem, and they are structuring the total curriculum and course of this program in a scientific way, so as to get the common minimum knowledge in the practical way for a physician to do the almost all the common clinical conditions of the children. And from my point of view, I will be dealing with several cases like autism and epilepsy and bleeding disorders of the children, muscular dystrophy, and some birth injuries, then hematuria, and some gastrointestinal issues, and the dose consideration of the children practical point of view. See, before dealing with this topic, I would like to express certain points in two ways. Like number one, in research point of view, even for a physician, you can start the research by documenting your own cases. You can publish your case reporting or case series. From the research point of view, whatever you are doing in your clinical practice, whether it may be a simply Dashmula to the CASA case or SWASA case, you document it in a scientific way that, for example, if it is a case series or case report, you will get international guidelines. You just type, simply Google how to report my case in an international format. Simply, you will get only care checklist. There is a checklist, that is care checklist. You simply document it. As I told you, you are treating the common cold with Dashmula Gadatrayam Kwadam. It may be a simple and silly matter so far an Ayurveda physician of India is concerned, but you are doing wonders so far. The total 7 billion people across the globe are concerned. This is what I am telling. But you are not supposed to say it in terms of your own language, that is, which is for you. That is the main fate of Ayurveda people, that Ayurveda people are so, what we can say, they are highly sticking to the particular theory that if they want to study Ayurveda, come here and we will teach Ayurveda. That's not a good theory at all. That's not a good theory at all. You disseminate your knowledge, which is understandable to the people who are in front of you. So there are care checklists. So what I am telling, all the capacity building process through this conference series, you take it in your heart, process it in your brain, and you disseminate in your paper. And later, you will understand that you are doing wonders. Especially so far the pediatrics are concerned. Because pediatrics is the least developed medical branch totally when we consider with other, when we compare with other medical specialties. So if somebody is treating allergic bronchitis in Kerala or India with 3-2 herbal medicines, it means that it is a big thing, because most of the people across the globe who are suffering from allergic bronchitis are actually fed up with by taking antihistaminics and analgesic drugs of their allopathic stream. And if somebody is getting a news that with this simple lifestyle modification, do's and don'ts in the activities of daily living, do's and don'ts in the food, and along with certain herbal medicine which were collected from the surrounding areas of their house, they are treating and they are curing it. It means that it is nothing but wonderful medical finding. So what I'm telling, all these are simple procedures, but these are highly wonderful medical interventions, and they are highly medical thought-provoking practices when we think about other scientific community. The second thing, from the public health point of view, you know, most of the pediatricians are fed up. Actually, they are totally fed up by administering several antibiotics and anti-epileptic drugs and several other antihistaminic drugs to the common day-to-day problems of the children. If you are reading Indian Journal of Pediatrics or American Journal of Pediatrics or whatever may be the common pediatric journals, 20% of the total articles will be the lacuna of the treatment from the biomedical society, that is allopathic stream, regarding the common clinical problems such as respiratory and GI tract issues. Wonderfully, all those are the issues which are usually managed by Indian Ayurveda community among the patients of our day-to-day clinical practice. And you have that public domain trust area in your hands. If you are fine-tuning, if you are making a fine-tuning of your clinical practice by aspiring, by imbibing the principles of these conference series, I'm damn sure you will be a powerful practitioner if you are documenting it and if you are disseminating it. In Malappuram district, I am doing such a public health activity with the help of Government of India, and we are targeting near about 4,000 children for their common clinical problem of their recurrent respiratory tract infection. You know, even in this corona period, we are continuing that public health activity. None of the 400 children who were treated for the last 6 months were COVID positive after this outbreak. And we are preparing that paper to be yet to be published in a good journal. So what I'm telling, all these are the wonders what we are doing from our day-to-day common clinical practice. Only thing is that by Pampa series, you just make the scientific fine-tuning of your own practice. That is the reason why, because I just wanted to highlight in epilepsy, what are the mistakes what we are doing. And we don't know what are our capacity while managing the epilepsy. For example, if one child is on anti-epileptic drugs, Valparin, okay, we have our own role just to prevent the Kapha-Pitta Dushti, which is initiated or triggered by the sodium valproate compound. Second thing, for example, whatever may be the epilepsy or autism, immediately we will recollect our own drugs like Manasmitra Padagam or Manamitra Churnam or Mahakalyana. But that Jwara paracetamol equation is not at all good to treat autism. There are certain mistakes what we are doing that I will highlight, and certain birth injuries and genetic issues. By hearing the birth injuries or genetic issues, we will consider ourselves that all those are incurable. No, probably it may be incurable, but still, if you can just pick up the biceps force or biceps power, that itself is a wonder. Or if you are able to make some pronation and supination smoothly in an Erb's palsy case, that itself is a wonder. Likewise, I will just make a torchlight upon the hidden areas where we can make the success in the birth injuries. Then muscular dystrophy, by hearing the muscular dystrophy, along with the parents, the physicians are also getting fed up. Previous, the eminent speaker like Krishna Kumar ji or Dilip ji, everyone told that such things can be well managed. All those are Kaijilsa people, and they know very well how this generalization of the Ayurveda principles can be coined out in such cases. Then what are the mistakes usually done by Ayurveda practitioners in muscular dystrophy? Okay, then for example, the hematuria cases and recurrent urinary tract infection. Everybody is treating, everybody is doing more 70 or 80% of the results. But 20% where we lost. Where we lost, that is very important. That 20% cases has to be considered into your clinical practice, made into a success, should make it into a success after attending this series. Likewise, the real posology. All of all we know that all we are very much fearful by giving the medicines to the children due to the one main factor, how much chemotherapy has to be given, whether it has to be half TAD or half OD, or if you are looking into Shargadara, in that only the Kola and Sarshaba, Marsha, these are the terminologies which are given, but the medical rep is coming in front of you with 1 or 2 tablets per day. So how can we do justification between these samhitas and this today's current practice? The practical point of view, how can we prescribe the Kwadas? How much Kwada can be prescribed? Is there any specialities there with Guguluta Kwada while prescribing to the pediatric children? Or if you are giving the Rasasantura, how much will be the dose? So these are the practical posology aspect that has to be discussed so as to remove our common physicians' fear in day-to-day clinical practice. These are the thrust areas where I will be making my points in the coming series. And once again, let me use this opportunity to congratulate all the team members of the Pampa for such a wonderful program. And once again, I congratulate the participants for getting into this conference series. Thank you one and all.
Thank you, Dinesh sir, for a wonderful introduction. There's a small correction. This is not Pamba. This is a Pratignja. It's a different platform. Very sorry.
Sorry. I always keep your name along with Pamba. That is why. Sorry, because Rahul Pamba and Shyam Mohan Pamba.
Yes,
this is the usual name which I am putting. Sorry.
Yes, no,
Big sorry.
Thank you, sir. Yes, thank you, sir. So let's move on. So we have, next we have Dr. Anil Kumar. So before I hand it over to him, please, I just want everyone to note that there is a link posted by Dr. Rahul in the chat box, which you can click and join a WhatsApp group where we'll be posting all the details about this course, the brochures, the curriculum, everything will be posted in that group so that you can have an informed decision. You can make an informed decision about joining this course. And now, so let me hand it over to Dr. Anil Kumar. So Dr. Anil Kumar MV currently works as a professor and HOD in Kaumarabhattya Government Ayurveda College, Trivandrum. Completed BMS from the University of Kerala, MD in the subjects of Swastavrta and Kaumara Bhattya from University of Kerala, PhD scholar, University of Kerala, 17 years of teaching experience in postgraduate and UG levels. Published many articles in magazines and journals, published a chapter on healthy lifestyle practice in Indian Healthy Directory, published by Rashtra Publications, presented many papers in national and international seminars, invited as research persons for the International Conference on Ayurveda at Colombo, organized by the University of Kelania, Colombo, reviewer of few international journals, resource person for seminars, workshops, CMEs, and ROTPs for state and central governments. Got many achievements like Kerala Ayurveda Research Appreciation Finalist Award 2008. So let me have it greatest, let me hand it over to Dr. Anil Kumar. Anil sir, hello. 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 Anil sir.
Hello.
Yes, sir. Over to
Hello,
you, sir.
Can you hear me?
Yes, sir. Yes, sir. Over to you, sir.
Okay. Okay. I see. I am outside my home and I'm in my car, so I'm not actually switching on my video.
Okay, no problem, sir. No problem, sir.
Okay. And first of all, let me thank Dr. Shyam Mohan and the team
Hello, sir. Hello.
Yeah, there is a bit of interruption.
Ah.
Okay, for the graduates who are actually pursuing certificate programs from various parts, and it is actually a novel.
Sir, kindly unmute, sir. Ladies and gentlemen, kindly be patient because sir is traveling and has joined us, in between travel. Over to you, sir.
Hello.
Yes, sir.
Okay. I congratulate the entire team for organizing such a wonderful event. It is indeed my privilege to actually highlight the important aspects of the pediatrics and especially the interest taken by the whole team for propagating the concepts and the practices in Kaumarabhattya. See, I have been assigned few topics, actually mainly 5 topics, which are more elaborate, and I usually take a lot of time for discussing all those things in common platforms. But here we have stipulated time, and I will try to conclude or concise the entire topic within the stipulated time period allotted. And from my clinical experiences, I'm confident that I can motivate the students who are attending the program. Uh, and for considering the present status of Kaumari Bhritya, especially in Kerala, we have qualified professionals in all over the state, and the institutions, especially the educational institutions, are playing a major role in propagating the old or the ancient practices in the field of Kaumari Bhritya. So we know that there were biological sagas in various parts of the parts of Kerala, and they were actually uh, concentrating more on the practical aspects rather than the theoretical ones. But some of the scholars, they took wonderful steps to write books in Malayalam, and most of them are purely based on their clinical experiences, as well as or based on the availability of the single drugs in the locality. So some of the experiences from my seniors and my uh, actually the my inquiries or the interactions with the older physicians actually motivated me to do or to follow simple remedies which are found to be very effective in managing the acute as well as the chronic ailments. So, as a physician, as an academician, and as a clinician and a researcher, see, I have more interest to actually to motivate the for the faculty as well as the students who are coming to my institution, as well as out of Kerala and in abroad, for uh, going into the deeper parts of the subject. See, there are practices based on the clinical experience, and there are practices purely based on the theoretical concerns. So always, and I am trying to highlight the more important aspects to the theory, and I will translate it in clinical terms to make it more feasible for a practitioner to practice it with confidence. So theory into practice. So that is the motto of my teaching as well as the clinical practice. So I'm actually I will be highlighting the important aspects of the theoretical points, and how it can be translated, or it can be converted as a simple a practical module. Okay, so practice is actually skill oriented, but only a physician who is thorough in the subject will be able to do a better practice or a perfect practice, especially in pediatrics. So the children coming to us have simple issues or simple acute issues, simple or minor illnesses like some cold or something like that. But nowadays the scenario has changed. You know that simple cold maybe due to a COVID-19 or SARS COVID something, or like some other influenza like viruses. So this is a situation which is prevailing at present all over the world. But here, I'm sure that the simple measures can be adopted, and even for complicated illnesses. So how it can be possible? How we can use the simple measures for a chronic ailment, and how we have to approach a chronic ailment with more sophisticated or more evidence-based, or a little more clearly, I can say that more modified therapeutical approaches. So these are all purely based on the clinical experiences and on in the light of the scientific framework of Ayurveda. So I won't generally compare most of the clinical illnesses with the modern parallel diagnosis, because everything comes under a particular spectrum of illness. If we take Vata Shonada, or if we take Visarpa, if we take Kushta, it includes it is considered as a spectrum of illness in which you can include all the manifestations having one or more similar characteristics mentioned under the context. Okay, so that being the case, you have to concentrate more on the symptomatology of the illness rather than the specific diagnosis, because in some of the cases, for example, the first topic given to me is on Visarpa. So when the patient comes to me after a course of treatment from other systems of medicine, or sometimes from other Ayurvedic physicians, so in that case, when I diagnose the case with the present complaints of the illness, I may be wrong in the diagnosis. So we have to assess the case in detail. We have to go back to the history part. Then, what were the findings earlier or at the time of manifestation of the illness? So whether there were any Purvarupas. So likewise, all the inquiries must be made before coming to a conclusion. So the presently it may look like Padma Kandaka or something like that, but initially it would have been something else if we received the case at an early stage of the manifestations. So a treatment can modify any treatment, especially Shuddha Chikitsa can also modify the illness, and then Ashuddha Chikitsa can also modify the illness. So Ashuddha Chikitsa, definitely it will modify the illness into another form or another complicated strata of the illness. So it is always important that the not only the presenting complaints are important, the entire case history, especially in the case of Visapa, Kushta and all, the entire case history is very, very, very important in the diagnosis. So we will be concentrating more on the clinical aspects rather than the theoretical aspects in the program, because after the completion of the course, the participants must be able to do a better clinical practice after the clinical practice with confidence. So that is my aim. So I'll be concentrating more on the clinical aspects. Okay. So the first part is clinical approach of Bala Visarpa. You know that uh, there are varying patterns seen nowadays, and we may not be able to see all the types of Visarpas mentioned in Arogya Raksha Kalpadruva. But instead, those diseases which are coming to the spectrum of Visarpa can be analyzed based on the doshas, and the manifestation patterns can be identified. And based on the role of Ritu, the role of diet, everything has to be correlated and well discussed well discussed before coming to a final diagnosis and a decision making. Okay, so that I will be covering in the first chapter. And coming to the second topic, it is childhood obesity. So you know that there is an increasing trend in the occurrence of childhood obesity, and it is actually a lifestyle disorder, but children are suffering from metabolic derangements due to multiple factors, and it can be a dietary origin, it can be due to long-term medications, it can be due to sedentary life habits. So we can correlate any cause with this particular disease condition. And I'm sure that you all are familiar with the childhood obesity. But how can we prevent this, and how can we employ certain principles for curing the major aspects of the manifestations of childhood obesity and the risk factors. Even nowadays, we are seeing cardiac arrest in small children, children with hyperlipidemia, hyper tension. So many things are there in the society. So this is another area which I'll be concentrating on. And coming to the third aspect, the hyperactivity disorders, the approach and assessment and its diagnosis and treatment. Uh, we have a lot of cases with hyperactivity disorder, uh, and earlier these conditions were considered as something coming under disturbances in the mental spectrum. But now we have specific approaches based on the doshas, based on the prakriti, and based on their habits, based on their familial environment. So whatever be the cause, we can treat confidently the hyperactivity disorders. So there are specific reasons for the manifestation of the illness, and there are specific routes to interfere with the pathogenic process. So we will be discussing the matter in detail during the session. Then coming to the fourth topic, it's common presentations in childhood asthma, related ailments, and differential diagnosis, investigations, and management in Ayurveda. See, this is another highlight of the certificate program, because childhood anemia is also increasing. And see, even after a lot of interventions from the health machinery, there are instances where childhood anemia is increasing alarmingly, especially in some of the selected populations in the state. So the Ayurvedic physicians have to concentrate more on the issues related. And coming to the adolescent aspects, there is another scenario, especially among the female population. So it is actually a vast area, and generally we will prefer some of the drugs like Lohasa than Hanabedism. There are so similar drugs, but here depending upon the cause, how we have to assess. Then regarding the Krimi Roga, so many interconnected portions are also there in this particular chapter. But here we will analyze the ailments, the childhood anemia, related ailments, and its differential diagnosis, and the whole aspects will be touching. And here also, an Ayurvedic physician needs a precise assessment of anemia from Pandu point of view, from and sometimes from Raktapitta point of view. So sometimes Shobha, sometimes Krimi. So there are multiple ways in which you can do an intellectual exercise to identify the exact pathogenesis undergoing. And the last and final topic is the most unexplored area of therapeutics in Ayurveda, the administration of Rasaushadhis. This is actually a challenging area for most of the practitioners, and since we are not confident. Okay, see, recently also I have taken an effort to propagate the use of Rasaushadhis in clinical practice. And actually my mentor is Dr. Shashi Kumar Nechir. Sir is doing a lot of work in the field, and he has more clinical experiences, and he shared most of the experiences and motivated me to do the clinical practice with rest studies, especially in the management of acute illnesses. And regarding the seizure disorders and ADHD-like diseases, there also it plays a major role. And in some of the cases where there is deficiencies, there also the resources play a major role. So if you want to impart an immediate response to a particular response in a particular disease condition. There is no doubt the resources these will be a better option. And so likewise, we will be covering all the topics in a serial fashion. And I think let us I'm hoping that most of the students will be attending all the sessions, because Dinesh, so Krishna Kumar, Arun, so many scholars, and they're all practicing and they're all teaching in the field with confidence. Yeah, I'm taking this as a responsibility to teach those who are eager to know the science, those who are uh, very much interested to study the subject again and again. So once again, I thank the organizers and as well as the participants for their keen interest to propagate the system of medicine Kaumara Pratya. So the system of medicine Ayurveda and the subject Kaumara Pratya. So I thank one and all for the patient listening, and I think I have covered much of the areas in relation with my talks in future. Mm, and I wish you all a wonderful uh, and a prosperous uh, clinical practice in future. Thank you.
Thank you, sir. Thank you. Thank you for that introduction. We know that you are traveling, so thanks to you for coming and introducing your topic, sir. Thank you. Thank you for that. And what sir said, 2 points. What he said as, we should be concerned about that. One thing, of course, as he said, we need to, start practicing. That is our basic idea. If you we will be having groups dedicated for this, so once you start practicing you will be having more doubts, and there will be a platform where you can ask the doubts to the teachers, and they will respond whenever they are free, and so that will be like a hand holding for the participants of this program. And another thing that, as sir said, one of the main thing that right now is happening is the children are sitting at home, and childhood obesity is increasing day by day, and that is a very relevant topic for if you are interested in practice. So we have one more teacher that I have to introduce. He's a very good friend of mine. We have Dr. Arun B Warrior. So let me give you a brief introduction of Dr. Arun. Dr. Arun B Warrior, Associate Professor and HOD of Kaumarabartyam he was at Ashtangam Ayurveda Vidyapeetham, but right now he is the Assistant Professor at the Kaumara Department, Vaidyaratnam Ayurveda College, Ullur. He has done his BAMS from Kottakkal and completed post-graduation in the subject of Kaumarabartya from Government Ayurveda College, Trivandrum. He was the Assistant Professor in the Department of Kaumarabartya at MVR Ayurveda Medical College, Kannur. He holds course certificates in childhood disability management and pediatric emergency management. He is a co-author of 2 books, namely Sadhya Sat, Satha Yoga, a compilation of 101 yogas to be studied during BMS course, and Anubhudam, a doctor desktop reference book. He is the coordinator of various programs and seminars. He took the initiative in starting Suvarna Bindu program, first of its kind in Kerala, Ayurveda Academy, and running successfully since last 3 years. Also started Venal Tumbigal, a residential program for schools going kids, and Sugasai Shavam. Sugasai Shavam, a school health program for the health needs of children. He is a regular faculty of seminars representing Ayurveda, Balajigilsa for national and international students. He deals with topic Kaumarapatya for international group of allopathy doctors since the last 5 years. So let me call upon Dr. Arun to introduce this topic. Dr. Arun, hello.
Hello,
Yeah.
sir. Hello.
Yeah. Over to you, Dr. Arun.
Okay, fine. Very good evening to one and all. Hope I'm audible to you all. Okay, fine. Namaste. So happy to be here with the team Pratignja. As we all know, excuse me.
No, please continue. I just want to. Yeah.
Okay, fine. I'm also traveling, and I stepped down in a hotel to talk to you. As Dr. Shyam told, this will be introductory session regarding the points which I'll be sharing during the 31-day program organized by Team Pratignja. I was hearing Dr. Dinesh sir and Dr. Anil Kumar sir. Both of them are my gurus. And happy to be with them, at least in this virtual space. And I'll cut short my description regarding what I'll be, because the time is 8:10 now. What I intend, or what I would like to talk to you, is the general pediatric management. As we all know, majority of the patients coming to a Kaumarapratyam OPD will obviously be coming from the developmental anomalies aspect, isn't it? A BAMS student who is doing his UG course will obviously be seeing n number of cases of autism spectrum disorder, hyperactivity disorder, mental retardation, Down syndrome, Turner syndrome, etc., 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 isn't it? On the other hand, after completing their BAMS course, if a neighbor comes to you and asks you that, doctor, you are a doctor, I have a child in my home and he is having a slight fever or respiratory infection. What can I do? So the first answer, I think, that comes to each and every one of our mind is, better take the baby to an allopathic pediatrician, isn't it? So I'll be trying to explore some areas, because I'm into this area since last 8 years, and I'll try to share my experiences regarding the management of common pediatric ailments. So I'll not be discussing with the big things. We'll be discussing the small things, including the fever, respiratory infections. We'll see how we can overcome the excessive or the unwanted usage of antibiotics and steroids. As we all know, WHO states that about 90% of the antibiotic prescriptions as well as the antipyretic prescriptions in pediatric age group is unwanted. Let us see whether we can harvest at least 70% of them. So coming to fever, the other prescriptions other than the paracetamol, what we can do according to Ayurveda, or what should be our approach in managing a fever case. And coming to respiratory infections, I'll be dealing with the common respiratory infections or common respiratory illnesses in a pediatric age group. Dr. Anil sir, as he told, he'll be dealing with the asthmatic conditions. So other than those, what we can do? And is there any option of nebulization in Ayurveda? All those things we'll be discussing. Coming to constipation and the loss of appetite, that is we usually say pediatricians eat because child doesn't, isn't it? So coming to loss of appetite, we want to know what are the causes of loss of appetite. And regarding the constipation, we usually advise Abhipatti Churna, Gandharva Hastadi Kashaya, so many things, isn't it? So how we can prepare a sensible or logical prescription regarding the management of constipation. And along with that, I'll be giving an introduction regarding the developmental anomalies. As a non-pediatric practitioner, what is the need of identifying a development anomaly at the earliest? It is just to make that child to utilize his potential, maximum potential, so that if possible, he may outgrow from the particular condition, even though the disease or the condition seems to be uncured. And the next topic which I will be discussing are the common skin lesions. I'll not be touching about the viscera or the so-called things which will be discussed by Dr. Anil Kumar sir.
Hello, Dr. Arun. Hello.
We'll be discussing about the common skin lesions, and for the interruption. Okay, and the last point which we'll be discussing will be about the Suvarna Prashanam. As told by Sham sir, I'm doing this Suvarna Prashanam in the Ayurveda Academy since last 6 years. So I just want to share my experiences in doing Suvarna Prashanam in a very cost-effective way. I'm doing it for just 10 rupees for a single drop, which seems to be a different thing when compared to the participants from Karnataka and all, because I have heard and I have experienced that they are charging 400 to 500 rupees per drop in Karnataka and Andhra. Here we can, I am utilizing this opportunity to share my experience regarding the economic aspect as well as the medical aspect, because being in Ayurveda Academy, rather than the economical aspect, the medical aspect or the Shastra Bhaga is more important while preaching the Suvarna Prashanam in academy, isn't it? So I was trying to explore that area, and I'll be sharing those experiences with you. And my sessions will not extend more than 1 hour, and 1 hour will leave for discussion for sure. So I would like to once again thank Team Pratignja for organizing this program and giving me an opportunity to talk to you. Thank you so much, Dr. Shyam sir.
Thank you, Dr. Arun, for even though you're traveling, you and Dr. Anil also both are traveling, and you came. Thank you for that. Thank you. grateful for your commitment towards teaching. Thank you for that. So let me give you just stop as soon as possible. So I'll just give you a basic idea of what is going to happen, and there are links in the chat which Dr. Rahul has posted, which you can click and join a WhatsApp group where we'll post all the details. Even this video that we are watching right now, the session that we are having right now will be posted as a link in there, so that you can, if you have come late to this meeting right now, you will be able to go back and have an informed decision, take an informed decision about joining this course or not. So if you have any doubts, please do post it in the group. One or two doubts we will be able to cover. Rest we'll have to leave in the group. This is a course fee that we are having. We have for practitioners, this is 4999, and we are giving a special discount for students as a 50% 2499. Please make a note that classes will be starting on the 1st of March, and we'll be having 31 classes, and we'll end on the 31st of March. And the timing of the class will be 8 to 10 p.m. so that there'll be no disturbance for your clinical practice, or if you're a student, there'll be no disturbance for you. So you'll be able to learn in the at that time. Again, all these details, all the teachers, whatever they are taking, everything will be posted in the WhatsApp group that I just pointed to you in the chat. It'll be posted by Dr. Rahul. So these are the topics. And why Subaalyam? Just want to give you a few pointers. The first one, of course, comprehensive sessions on clinical approaches of pediatric ailments. This is we have what our aim is that even if you're not a Kaumaravritya specialist, a patient, if a child comes to your clinic, you should be able to at least have a basic idea about how to treat the child, and start. Just my point, if you are not able to treat a child, how will that child grow up and accept Ayurveda as a treatment system? So the next point is exploring the strength of Ayurveda in child healthcare. These are the experts, these are the teachers who are experienced in this field. They will be able to give you a complete picture of how what Ayurveda can do in child healthcare. Dynamic faculties to handle the session, which already we have covered. Post-session discussions at your fingertips. Precise discussion on unexplored areas of Bal Chikitsa, diagnostic approaches to pediatric emergencies. Again, all these will be posted in the group so that you can go and check again. The faculties. This is what Pratignja does. We bring in the eminent faculties, and that is we take pride in our faculties, because these are the people who are experienced, and this is what we are offering. The term Pratignja means promise, and this is the promise that we can give you. Okay. Now, if you want to visit us, you can visit us at www.pratignja.com. Reach us at if you want to have a suggestion, or if you have any complaints, if you just send it to pratignja@gmail.com. These are the two numbers that I would ask you to take a screenshot of or note down in the brochure, which we'll be posting. These are the numbers you can contact and have the details inquired. Again, the Subaalyam program is going to start on the 1st of March. Just want to give you a small piece of advice before we close. Life is not about waiting for the storm to pass. It's about learning to dance in the rain. These are the partners of Pratignja, Dr. Anjana Unnikrishnan, Dr. Rahul J, and myself. So if you have any more doubts, please do feel free to contact us. And let me just, since there are no other questions in the chat box, let me just leave you with a small quote. Keep learning and keep growing. So thank you all for coming in. Thank you all for your patience, and I hope we will be able to give you, good session on Kaumara. Thank you all. Thank you.